The title of our paper is an investigation of the shape of the hoof capsule in hind limbs, its relationship with the orientation of the distal phalanx, and comparison with forelimb hoof capsule conformation. My name is Karolina Kalka, and I had the privilege of performing this study during my internship at the Animal Health Trust alongside Drs. D. Pollard and Sue Dyson. Several recent publications have related the orientation of the distal phalanges with the anatomical site of injury in hind limbs, with varied results. However, we still lack evidence-based data about hoof capsule shape in hind limbs of non-lame and lame horses. There is also a paucity of data describing the orientation of the distal phalanges in hind limbs and its relationship with hoof capsule shape. Our aims were to describe hoof capsule shape based on lateral photographs of the feet and to compare hoof capsule shape in forelimbs and hind limbs in a large convenient sample of horses of variable breeds. In a subset of horses, we documented the orientation of the distal phalanges based on their radiological assessment and compared this with hoof capsule shape. We examined 225 horses and collected data from 890 feet. To be included in the study, horses had to have been trimmed within 6 weeks. We documented the breeds of all the horses and whether they were shot or unshot. We used lateral photographs to obtain angular parameters such as the angle between the dorsal aspect of the hoof capsule and the ground, and the angle between the heel and the ground. We also collected linear measurements of the hoof capsule and used ratios of these measurements in order to compare the results within and among horses of variable sizes. Lateromedial radiographs of the hind feet were used to determine angles of the solar and dorsal aspects of the distal phalanx to the weight-bearing surface. We also assessed whether the dorsal aspect of the distal phalanx was parallel to the dorsal aspect of the hoof capsule. Contrary to the earlier descriptions of the so-called ideal shape of the equine hoof capsule, the dorsal hoof wall was not parallel to the heel in both the forelimbs and the hind limbs. The heel angles were smaller. We showed that both the dorsal aspect of the hoof and the heel angles were larger in the forelimbs compared with hind limbs. Unshot hind feet had larger dorsal hoof wall and heel angles than shot feet. The dorsal hoof wall and the dorsal aspect of the distal phalanx were parallel in hind limbs. Median angle of the distal border of the distal phalanx to the horizontal was 0.6 degrees, which was smaller than published values for forelimbs. We demonstrated that the orientation of the distal phalanx in hind limbs is correlated with external characteristics of the hoof capsule. We discuss why dorsal hoof wall and heel angles are different in hind limbs compared with forelimbs and how this may be related to biomechanical loading. We also discuss the effects of shoeing versus being barefoot. We concluded that evaluation of hoof capsule conformation of the hind feet may be useful to predict the orientation of the distal phalanx within the hoof capsule, and we suggest that evaluation of hoof capsule shape in hind limbs should be a routine part of clinical assessment of horses. We hope you will enjoy reading our paper, and we would like to thank Equine Veterinary Education for publishing it.